At the ASH 2022 meeting, we had a Friday satellite symposium talking about using CAR T-cell therapy to leverage these powerful new treatments to improve patient outcomes. At this session, we heard some great new updates on some of the data we've seen before, showing that CAR T-cells now have a long-term follow-up with more than 5 years follow-up. We saw data both in large cell, in follicular, and mantle cell, and CLL, and have seen an incredible advance. And what I would say is the take-home point for CAR T-cells is that CAR T-cell therapy for lymphomas is changing paradigms, both in terms of being able to cure patients in second line or in third line, and to being able to deliver these powerful therapies to patients who never would have been able to receive an autologous transplant because of age or frailty. So CAR T-cells, I believe, are here to stay and are going to be an increasingly large part of our weapons against cancer. The one thing I would say to the physicians at home is do not prejudge which of your patients might be a candidate for CAR T-cell. At this session, we talked about a few studies enrolling elderly or frail patients, those who couldn't tolerate high-dose chemo. They did great with CAR T-cells. And so sending your patient to a CAR T-cell center to be checked by the CAR T-cell physician to see if they could do that would be wonderful. Our oldest patient at MD Anderson who's received CAR T-cells is 91 years young. So don't guess which patients can't get CAR T-cells. Send them on to the CAR T-cell center to check out their capacity to receive this potentially life-changing therapy.